What is the connection between attention deficit hyperactivity disorder and post-traumatic stress disorder? The connection between attention deficit hyperactivity disorder, and post-traumatic stress disorder, is that the symptoms of each condition can mimic one another, sometimes increasing the chances of a misdiagnosis. This problem is often prevalent in children who exhibit symptoms of attention deficit hyperactivity disorder such as difficulty concentrating, hypervigilance, and risky impulsive actions. The main difference is that these children have experienced an especially frightening or disturbing event such as war, domestic violence, or a natural disaster. Their resulting behaviors can often cause confusion among mental health therapists who may not be experienced in differentiating between attention deficit hyperactivity disorder and post-traumatic stress disorder. Attention deficit hyperactivity disorder and post-traumatic stress disorder often have similar surface symptoms in young sufferers who have not yet developed the advanced communication skills needed to describe traumatic events in detail or to articulate the lasting effects. Mental health professionals can usually gain deeper insight by asking such patients specific questions about past negative life experiences that could be possible causes of post-traumatic stress disorder. One of the main differences between the two conditions is that post-traumatic stress disorder in both children and adults carries higher amounts of anxiety, fear, and worry. Psychologists or psychiatrists often note high rates of negative emotion about a certain event as supporting evidence for diagnosing post-traumatic stress disorder. Some differentiating symptoms of attention deficit hyperactivity disorder include prominent feelings of frustration rather than anxiety. Many attention deficit hyperactivity disorder sufferers feel periodic anger towards themselves for their distractibility and difficulties focusing on one task or conversation at a time. These negative feelings often lead to socially inappropriate outbursts in children with attention deficit hyperactivity disorder and relationship problems among adults with attention deficit hyperactivity disorder. Both attention deficit hyperactivity disorder and post-traumatic stress disorder carry higher risks of substance abuse for adults as well. Signs of post-traumatic stress disorder can frequently include persistent nightmares, insomnia, and visual flashbacks of the traumatizing event while awake. These types of symptoms can cause noticeable problems with school or job performance that are often associated with attention deficit hyperactivity disorder. Mental health specialists often report that both men and women with post-traumatic stress disorder have difficulty facing otherwise common life situations that reminded them of their trauma. These particular behaviors are usually deciding factors for different attention deficit hyperactivity disorder and post-traumatic stress disorder diagnoses. Treatments for attention deficit hyperactivity disorder and post-traumatic stress disorder are also markedly different. Many people diagnosed with attention deficit hyperactivity disorder benefit from prescription medication combined with behavioral therapy. Some attention deficit hyperactivity disorder sufferers may also find biofeedback an effective treatment option. Post-traumatic stress disorder sufferers are also treated with psychotherapy that can be more intensive and different in its approach.